Good morning, everyone. Thank you very much for being here with us today. Thank you for expressing your interest in participating in this webinar. It was a pleasure for the HPH network to organizing and co-hosting this webinar on children's rights to play and participate in artistic activities in healthcare settings with the Red Noses International. Thank you very much, in particular to Silvia De Faveri, who is with me here today, to Carmen Valero, who assisted, more than assisted, practically led all the process of organizing this webinar together with Fatima. I will not steal too much time in this first few words for introducing the webinar and go straight to my presentation because we have very high-profile speakers. Thank you very much for being with us today. So I will start with my presentation, keep it very short in order to give them room because they have very, very interesting things to say. So I will share my screen for the moment, hoping you can see it and everything is running smoothly. So again, thank you very much for being here with us today. I'm Ilaria Simonelli. I am the coordinator of the task force HPH-CA. It is a task force with, which is operating inside the international HPH network. And we deal with all the issues of health promotion and children's rights. And we are very much focused on realizing activities and creating tools for promoting the health and well-being of children and adolescents in healthcare services. I know Dr. Professor Oliver Gröne was supposed to be here today to present this part to you. He is currently building the HPH network. He's on a mission, so he couldn't be here today. He sent his regards, of course, and he asked me just to give a few words on what is the HPH network, just so you have a clearer picture on our work. We are a network, of course, an NGO founded by WHO. We have more than 30 years of history and experience in the field of health promotion and health promoting hospitals and healthcare services. We have nearly 600 partners, members in 30 countries. We are growing. That is why Oliver is not with us today, is building new networks. Our goal is salutogenesis and health promotion, which means finding all the factors that promote and create health, not only factors that threaten health. So this is our main goal. And we realized and carried out different phases of work to create tools like the standards you can find published in the HPH network website. I leave the link here. All the presentation will be available after this webinar, so don't worry if you lose some slides. The task force HPH-CA operates inside the HPH network since 2004. Our main mission is to apply the HPH principles and criteria to specific issues of children and adolescents. As you know, as a population, they have very specific topics linked to them. So we are trying really to focus our attention on which they are and how we can have a positive impact on those factors. We have built throughout the years a child-centered framework. We think that the child is an holder of specific rights. That's why we operate through a child rights-based approach. This means creating frameworks, principles, also paying attention to declarations at international level and trying to find a way to enforce them, to make them practical as well. We think that the child is also a carrier of specific needs, as I said before. That is why we focus very much on specific aspects, strategies, and tools that really apply to their needs. And we think they are also bearers of specific assets. They are incredibly capable of becoming salutogenic agents for their parents, for example. And this means for us also to study internal and external salutogenic factors that have an impact on their health. So this is mainly our framework of work as a task force. Our references are pretty famous, and they are currently jeopardized, honestly. Not only currently, but they have been throughout the years in terms of violation of children's rights. But these are our main references: the Universal Declaration of Human Rights, of course, that protects and promotes health as a human right, and the Convention on the Rights of the Child, which states that all the states should strive to ensure that no child is deprived of his or her right to access to such healthcare services. We have also other key references to our work. One is the human rights-based approach. We tend to think that children's rights are measurable standards and not only principles. So they should be taken as tools to measure professionals' activities' impact on children's health as well. We pay very much attention also to how these principles can have a practical meaning that has an impact on children's health, monitoring and evaluation, applied research, everything that derives from these principles, from the human rights framework, is for us an element to study and to try to implement. And also engaging children and their communities in identifying factors and mobilizing protective mechanisms as part of wider community development. Children are members of a community. They often have a positive impact on these communities, so they should be supported and put at the center of every community's attention. Our tools are many. We have been, throughout the years, we have been defining and participating in the definition of tools to measure children's rights, because their rights are standards and they have to be measurable. So this was our main work. Our second tool was the manual and tools for assessment and improvement of children's rights in hospitals and healthcare services. So we try to keep always a very practical view on our impact on children's health. Of course, there are principles, but we need to enforce them throughout tools as well. We have been defining the self-evaluation model and tool, which has been adopted by WHO, and the standards on health promotion and children and adolescents. This was adopted also by Taiwan. That was a very participated work in our task force, so it was very felt as well. And it was also useful for defining broader standards framework, so I'm happy to see it was useful. If we look also at the evidence on children's participation, which is one of the tasks we had in creating the standards for health promotion of children and adolescents, we see that children's participation in healthcare is not very much applied, at least not everywhere. It is an issue. It is an issue for children to become a group of patients which is consulted, referred to. And so children's views are not always very much included in planning services. You can see here some references. I'm not going to detail on these. They are available for you, of course. Physicians could improve the level of participation of children in their activities, also through very simple tricks, I would like to say, like asking some kind of questions that children can understand, like adjusting their language, like ensuring that the child has understood the content of the communication. But evidence says that many times children are excluded by the communication between the parents and the physician or the professional in general. And we also have evidence at our disposal, video evidence, that many times in consultations, both the general practitioners and parents displayed non-supportive behavior towards the child. So children's participation, we could say, is still in progress. We needed to adjust also professionals' practices and communication towards the child. But we also have, when it comes, for example, to the Article 31 on the right of the child to rest and leisure, also to play, we also have to state that there is positive evidence on the fact that gradually professionals are understanding more and more the importance of arts, play, on the mental and social health and well-being of the child. So this is positive. I would like to recommend these two references that have been suggested also by Red Noses International, WHO report from 2019, which is a scoping review that proposes also a very interesting logical model for linking the arts with health. So that could be very useful also for physicians and medical doctors to understand if this kind of pathway can be implemented in healthcare services and in hospitals. And also the Culture for Health report of 2022, which is pretty recent and that supports a holistic approach to health. And this way, culture supports health, well-being at individual, community, and also at economic level. It is sustainable. I don't want to steal too much time because, as you can see, our program is very rich. And I would like to tell you one thing first, that we are here today, of course, to elaborate on the right to play and arts and on children's rights in general. Let's not forget that there are children living in work conditions worldwide, and that it is our duty, I believe, to work for them and find ways to improve their lives. We work in healthcare services, but of course, this is a principle that goes beyond health services and hospitals. And I would like to ask you if you have any questions. I can answer, of course, at the end of this webinar during my wrap-up session, because right now I would like to ask the first speaker, Dr. Niels Fiche. I hope I'm not mispronouncing your name. If so, I'm sorry. Who is a technical officer within the Behavioral and Cultural Insights Unit at the WHO Regional Office for Europe. He is leading work on arts and health, coordinated the first ever WHO report on the evidence base for arts and health interventions, and he is co-founder, co-director of the Jamil Arts and Health Lab, with a focus on policy development and research implementation. So it's very nice to have you here, and the floor is yours. Thank you.
Thank you very much, Ilaria. Thank you for the kind introduction, and you said my name perfectly. I'm very pleased to be here, very pleased to have the opportunity to say a few words. So my name is Niels Fiche, and I work in the WHO Regional Office for Europe. I'm going to try to share my screen now as I kind of share with you this journey through arts and health that we began a few years ago, and which is beginning to accelerate and also bear new fruits. So before I begin, can I just make sure that you can see my slide? Maybe somebody can let me know verbally because I can't see anyone.
Yes, we see it.
Fantastic, great. So I thought maybe I'd start with a quick reminder, really. A reminder to ourselves that long before humans knew about penicillin or genetics, they created music and art. And I would say that's probably because our need to express our hopes and fears, to create meaning from our surroundings, or to share this through artistic creations with others, is probably as profound, as necessary as our need to quench our thirst or to still our hunger. Now, I think in that context, maybe we shouldn't be surprised that art can improve health or that art can give us well-being. The famous French painter and sculptor Georges Braque once summarized the relationship between the arts and health in a way that really only an artist can. And that's the quote that you see here. Art, he said, is a wound turned into light. Now, research is really increasingly showing how cultural activities and arts interventions in particular can have a measurable impact on our health and well-being. Even before the COVID-19 pandemic, health systems across the WHO European region and the world were stretched. And in the wake of the pandemic, they've been stretched often beyond their limits. To tackle the rising rates of mental health issues, for instance, and to help health services cope, an intersectoral approach is necessary, one that embraces the opportunities that the arts and the culture sector can provide. Now, countries across the region are exploring this synergy between health and culture through innovative approaches like social prescribing mechanisms, for instance. These allow health providers to prescribe cultural activities like going to the museum or joining shared reading groups to patients suffering from a range of health challenges, from low mood and anxiety right through to depression. So as I mentioned, and as has already been said by Ilaria, our journey here really began in 2019 when WHO Europe published its first scoping review on the evidence base to support the impact that the arts can have on health. And throughout this presentation, there are little QR codes in the bottom right, which if you screen grab and scan with your phone, you'll be taken directly to the relevant report or publication that I'm describing. Now, the review highlighted that, especially in the area of mental health, there is a growing literature on the preventive benefits of arts engagement. Activities like, for instance, making and listening to music, dancing, art, visiting cultural sites are all associated with stress management and prevention, including lower levels of biological stress in daily life and lower daily anxiety as well. Now, this report really was a substantial piece of work. It brings together over 3,000 publications that illustrate the positive effects that arts interventions can have on a range of health challenges across the life course and throughout the continuum of care. It includes performing arts, visual arts, including design and craft, literature, culture, online, digital, and electronic arts. The report shows us that the arts can tackle wicked or complex health challenges like diabetes, obesity, and mental ill health, offering solutions that common medical practice has so far been unable to address effectively on its own. So I want to go into a few areas that the report focuses on, just to give you a bit of a sense of the breadth of activity that the arts can have, the breadth of effects that the arts can have in relation to health. So the report found evidence of the contribution of the arts to the promotion of good health and the prevention of a range of mental and physical health conditions, as well as the treatment or the management of acute and chronic conditions arising across the life course. Even though there's still a lot to be done in this space, the report also found that the arts can be cost-effective solutions since they can frequently draw on existing assets or resources, even though, as I said, more research is needed in terms of the health economics of this field. The report also found that the arts may help in providing multi-sectoral, holistic, and integrated people-centered care, addressing complex challenges for which there are no current healthcare solutions. And the report is clear that the arts can help countries reach the integrated targets of key global frameworks like the SDGs, for instance, which aim to increase human capital and reduce inequity and promote multi-sectoral action for health and well-being. So in terms of prevention and promotion, the arts can affect the social determinants of health, for instance, by developing social cohesion and reducing social inequalities and inequities. The arts can support child development, like, for instance, enhancing mother-infant bonding and supporting speech and language acquisition. The arts can encourage health-promoting behaviors, for instance, through promoting healthy living or encouraging engagement with healthcare. The arts can help prevent ill health, including enhancing well-being and reducing the impact of trauma or the risk of cognitive decline. And they can support caregiving, including enhancing our understanding of health and improving clinical skills. Now, in terms of management and treatment, the arts can help people experiencing mental illness at all stages of the life course, for instance, by supporting recovery from perinatal mental illness and after trauma and abuse. They can support care for people with acute conditions, for instance, by improving the experience of and outcomes in care for hospital inpatients and individuals in intensive care. They can support people with neurological disorders, including autism, cerebral palsy, stroke, degenerative neurological diseases, and dementias. They can assist in the treatment of non-communicable diseases, including cancer, lung disease, diabetes, and cardiovascular disease, and they can support end-of-life care, including palliative care and bereavement. Now, with so much potential evidence and so much potential in the arts and health, the report we published, as well as a subsequent report, also highlights some potential policy actions. Now, supporting the implementation of the arts interventions for which there is a strong evidence base is one of the key recommendations that we make. There are a number of very highly evidenced interventions which the report includes, which really show that the arts can have an important impact. This can include, for instance, the use of recorded music for patients prior to surgery, or arts amongst dementia patients, and community arts programs for mental health. Another recommendation that the report makes is that it is really critical that we share with other countries knowledge and practice from effective interventions, and as well as case studies that have used the arts to promote health. And that's why these kinds of webinars, like the one today, are really vital in spreading the word and good practice of arts and health. And of course, it also emphasizes the need to support research in the arts and health, particularly focused on policy-relevant areas like studies scaling up interventions to larger populations or exploring feasibility, acceptability, and sustainability of new arts interventions, as well as the health economic impact of arts interventions as well. Now, in terms of recognizing the added health value of engagement with the arts, the report recommends that culturally diverse forms of art are available and accessible to a range of different groups across the life course, especially those from disadvantaged minorities. It encourages arts and cultural organizations to make health and well-being an integral and strategic part of their work. And this is really something that cultural organizations often are unaware of, the fact that their work inherently has a health benefit and that they might want to focus in on that within their strategies. It recommends the active promotion of public awareness of the potential benefits of the arts engagement for health. And it encourages the development of interventions that encourage arts engagement to support healthy lifestyles. Now, finally, in terms of the cross-sectoral nature of the arts and health field, the report recommends the strengthening of structures and mechanisms for collaboration between the culture, social care, and health sectors, like introducing programs that are co-financed by both arts and health and social care budgets. It encourages the development of stronger lines of referral from health and social care to community arts programs, for instance, through the use of social prescribing schemes. And it encourages the support the inclusion of the arts and humanities within the training of healthcare professionals. So I've said quite a bit about the report, and I just wanted to point out the interconnectedness between play and playfulness and the arts and health. Play in many ways is a fundamental component of many arts and health interventions in which patients actively participate, whether it's playing music or participating in a theater play or role playing or arts and crafts, dancing, and of course, clowning. Helps to motivate, destigmatize, build empathy, and create space for healing. In essence, you could say that the entire report is about how different forms of play and playfulness in the medical setting can support health and well-being. I wanted to say a few words about some of the concrete findings that the report brings together. For instance, that how arts activities in emergency settings, including music, craft, and clowning, have been found to reduce anxiety, pain, and blood pressure. The report draws on resources that show that clowning before operative procedures has been found, particularly in children, to improve patient satisfaction and willingness to repeat the procedure. Some exploratory studies even have found further changes in respiratory rate, skin temperature, systolic blood pressure, salivary cortisol, and glucose with reduced length of stay. Now, play therapy incorporates creative activities like storytelling, coloring, and pictures, and all of these things can reduce anxiety as much as preoperative medication. They can improve patients' communication with staff. They can reduce negative feelings, and they can improve patients' satisfaction with nursing care. Role play and modeling through theater has been found to support the social engagement of children with ASD, for instance. And learning and performing magic tricks can improve hand functioning in children with hemiplegia, which is a paralysis affecting one side of the body. Now, it's important to say that all of this is in relation to structured, trained, and intentional forms of play. Now, that's not to say that informal play doesn't have its health benefits as well. But I think it's worth saying that a lot of these interventions, like, for instance, clowning or art therapy, are forms of professional play that require training and require well-structured and well-evidenced forms of interventions. I just want to give you leave you with a couple of slides that are about the future of work that we're doing at WHO. And I wanted to highlight one project in particular, which is about youth and mental health in Greenland. As Ilaria was saying in the beginning, a critical component of these kinds of interventions is to also give a voice to the people that you are designing an intervention for. In this case, we're targeting the mental health and well-being of 16 to 19-year-olds in Greenland. And the reason we're doing this is because Greenland has has the highest youth suicide rates in the world. So we're co-creating an arts and health intervention that uses play and playfulness in order to help destigmatize the ability to talk about mental health and hopefully improve the mental health of young people in that country. And although it's a pilot project, we're hopeful that through rigorous evaluation and replication of the intervention, we can have some form of positive impact on the youth mental health challenge that Greenland is currently facing. I also wanted to raise your awareness of a new endeavor that we are collaborating on, which is the Jameel Arts and Health Lab. The Jameel Arts and Health Lab was launched in February 2023. It's a collaboration with New York University, with an organization called Culture Runners, and with WHO. And it focuses its work on arts and health on overlooked and underserved communities, trying to amplify research, coordinate evaluations, and increase policy uptake. The QR code that you see there in the bottom takes you to the website, but the website is actually under development, and we hope to soft launch a new and much improved website with lots of information about the work that we're doing in the coming weeks. So do stay tuned and keep that on your radar. Now, finally, I wanted to say what we're doing next. Given that in terms of research, given that the scoping review we published is already a few years old. And I'm very glad to be able to say that earlier last year, we were commissioned by The Lancet, the leading medical and public health journal in the world, to produce a series on arts and health, which focuses on non-communicable diseases. So we're looking forward to publishing that in 2025 and hoping to continue the momentum that we've built in relation to arts and health into the coming years. So I'll leave it at that. Thank you so much for giving me the chance to speak with you today, and I'm happy to take any questions if there are any. Thank you so much.
Thank you for being here with us today. You gave us a lot of very interesting and useful elements. We have many people with raised hands, so I don't want to steal time or space to them, but I would like to ask Fatima if we can let the first one, Chiara Manavella, speak, because Fatima is managing all the speakers.
Yes, hello. I wanted to ask, what are the biggest challenges right now to see arts for Earth become truly integrated in the healthcare system? And what kind of practitioners from the arts as well as health field do the best to support the change in policies? Thanks.
Thank you. That's a great question. You know, even though there's been a truly impressive building of momentum in the arts and health space, especially I would say over the last 5 years or so, there are still a lot of challenges. So I'm going to single out one because you're asking in particular about integrating into the health systems, but there are still a lot of challenges also in terms of evaluation, evidence, public awareness, and awareness amongst doctors, physicians, and in hospitals. So there are a number of challenges, and we're continuing to work on a lot of fronts. But in terms of integrating into healthcare systems, the big challenge here is creating a modality which allows that to happen. So say an individual presents with certain health challenges, maybe a mental health challenge, maybe something like loneliness, trying to find a way to move them into an arts and health intervention, even where they exist in countries, can be complicated. And this is where social prescribing or community referral mechanisms, as they're sometimes called, come into play, which is essentially a mechanism that allows a physician or a family physician to whom the patient is presenting, allows them to refer that person perhaps to a link worker who specializes in the space of arts and health offers, and who can in turn, through an additional consultation with that individual, find out exactly what type of arts and health intervention might work best with them. But those kinds of systems are really kind of in their infancy. So the UK is probably the most developed in this space, but other countries, including Austria and Greece and other places in Europe, are also becoming very interested in this space and developing their own forms of social prescribing. But that, I think, is really the key right now, is to develop those infrastructures so that patients can get connected to arts and health interventions.
Thank you very much. Thank you. I see another question with raised hand. Laura Cambra Rufino. So please, you can speak. Then I would like to ask Christina Wagner to write down her question on the chat, because there are many questions, and I understand there are other speakers. So I want to be fair, but other people have to speak. So. Okay, so please write your questions in the chat. Okay, so as I see that Laura is not speaking right now, I would continue. Thank you very much, Niels. Please stay with us if you can, and look at the chat if there are questions for you. Please help us through this, because you really brought very useful elements for us. And as Chiara said, we need to understand how to put them into practice in healthcare services as well. So thank you very much. Thank you.
My pleasure. Thank you so much. I'm happy to answer questions in the chat.
Great. Thank you. Thank you. And Lisa, Dr. Lisa Gugelberger, I hope always for the name, I pronounce that right. If not, forgive me. She works at the Competence Center Health Promotion and Health Care, which is part of the Austrian National Public Health Institute. And her current work focuses on child and adolescent health, as well as health promoting and health literate settings. So thank you very much, Lisa, for being with us today. Please, the floor is yours.
So I just needed to unmute myself. Thank you very much for the invitation. I'm very happy to present the Child and Adolescent Health Strategy in Austria today, which is an example of how to integrate children and adolescents into policy with the aim of strengthening children's rights in health promotion and healthcare. I work at the Austrian National Public Health Institute, and there I am part of the Coordination Center for Children and Adolescent Health. So I'm going to give you a brief overview of what I'm going to talk about. I'm going to start with some history of the strategy in Austria. I'll show you the 7 thematic areas of that strategy. I'm going to then strengthen the parts where it's about children's rights to play and participate in artistic activities in healthcare settings. A very, very brief history. I need to give you some context as to why this strategy even exists. But I'm going to run right through those slides. So I've been told that they will be available later on. So if you'd like to look at it in more detail, please look at the slides afterwards. So in 2010, it started that the Austrian Ministry for Health wanted to start the process to develop the first child health strategy. So in 2010, it was still focused on children only. The aim was to a sustainable improvement of child health as adolescent health in Austria. So this was a health in all policies approach. It was based on the determinants of health and on children's rights. It was first published in 2010, and then it was published again in 2012 with adolescents included as well. And back then it had 5 thematic areas. We jumped to 2016, which is when the Coordination Center for Child and Adolescent Health was founded at the Austrian Public Health Institute, and also an intersectoral committee for child and adolescent health, which is put together by different experts from politics, the different provinces, from the insurance and so on, to work together for better health for children and adolescents. For the 10-year anniversary in 2021, we published some so-called mini updates. And then finally, now we're arriving in 2024, which is when we are going to publish a new updated strategy. So it should have been published already. When I agreed to do the talk today, we were sure that it would be published by now. I am informed that it will be published sometime this or next week. And I am able to present it to you anyways. We thoroughly revised the strategy together with the Committee for Child and Adolescent Health, and have included some new aims, some new goals, and also 2 new thematic areas. So especially the ones I'm going to focus on for the talk today is living space for children and adolescents, and also the one that deals with healthcare for children and adolescents. So I'm going to briefly go through those 7 thematic areas of the strategy. Most of them I will only touch on very briefly because I will put a focus on the areas that touch on today's topic regarding children's rights to play and participate. So the leading principle for the first thematic area, which is the societal framework, is it's important to raise awareness in society regarding the special needs of children and young people. So goal number 1 is consider the needs of children and adolescents, which concerns all policy areas that are required to consider and include children and young people into their respective fields of activity. And goal number 2 is to take cross-policy responsibility for health. This means that health in all policies, or rather a health for all policies approach, should be set up. 2 is a healthy start in life. So health promotion and prevention are more effective the earlier they start. Goal number 3 says lay the foundations for a good start during pregnancy and birth. This means that there needs to be structured and standardized care for mothers before and during pregnancy and around the time of birth. And goal 4 says set the course for long-term health in childhood, which draws attention to the importance of stable environment and positive effects on a child's health. Healthy development. Here, it's about all children and young people should have the same opportunities to grow up in the best possible way. So here, the different goals are kind of self-explanatory. So this is about strengthening the life skills and health literacy of children and adolescents. It's about understanding that education is a key factor for health promotion and health. It's about enabling and promoting physical activity for children and adolescents, and about enabling and promoting healthy eating among children and young people. So thematic area 4, living space for children and adolescents. This is the new thematic area in the strategy that I want to put some of the focus on. Because we've created this new area because while working on the different areas and goals, we noticed that a lot of the new goals that we wanted to include were about space for children to play, to move more freely, to be creative, or to simply put, for children to just be themselves. This that in order to grow up healthily, children need safe, appealing, and easily accessible spaces in which the framework conditions enable healthy choices regardless of social differences. Here we've included goals that really cover a lot of different areas, a lot of different spaces for children and adolescents. So the first one is to create healthy settings. This means that everyday settings, central settings of everyday lives for children and young people, the home, educational childcare facilities, schools, sports and leisure clubs, and so on. These all need to be developed in a way to be healthy for children and adolescents. It also includes hospitals, which is your area here. Goal 10 says is about mobility, climate-friendly mobility. So here we've worked with people that come from the climate movement and include a safe mobility for children. Goal 12 is to promote child and youth-friendly housing and building culture. So this means implementation of child and youth-friendly planning standards, for example, for large construction projects such as hospitals. And goal 13 is to use digital space as an influencing factor for health. So here we framed the internet as a setting or a space that children and adolescents spend time. And here we raised the issue of also this digital literacy and child protection. So some more background as to why we included this new area. We feel that children and adolescents need safe, appealing, and easily accessible spaces. Play, leisure, and activity areas are needed for children to develop their full potential. So this means only in those safe spaces they learn about their strengths and abilities. They learn about their limits and how to deal with dangers. They can acquire the skills that they need to deal with realities of everyday life and social lives. As you've seen in the different goals that we cover, this applies to all settings. So it's everyday settings such as nurseries, schools, and so on, hospitals, but it's also public spaces, public transportation, anywhere that children and adolescents move and spend time. And we've also included architecture of buildings, the mobility, the open spaces that need to consider children and adolescent needs. So we're moving on with equity, which is the fifth thematic area. Early identification of support needs an important cornerstone for supporting children and young people from socioeconomically disadvantaged backgrounds and those with health problems. So this includes to ensure equal opportunities. Social inequalities usually lead to health inequalities and vice versa, so barriers to access existing services, both financial and administrative, have to be removed. Goal 15 is equal opportunities for disadvantaged children and adolescents in terms of health. So this builds on the previous goal, but concerns children and adolescents with chronic diseases specifically. And 16 is to improve early detection and targeted support for children and adolescents, to further expand the preventive medical checkups for babies, further preventive checkups for all age groups. Thematic area 6 is the healthcare for children and adolescents. This is the first of two thematic areas that focuses on the healthcare setting and the hospital setting. So all of the previous areas have focused on children in everyday life and have focused on a whole health promotion approach. And thematic area 6 and 7 focus on the hospital setting and on healthcare for children and adolescents. So the care of sick children and adolescents is guaranteed in Austria, but however, there is still a need for optimization in pediatric primary care with a regard to pediatric expertise in emergency care. So this goes into quite a lot of detail because we worked with quite a lot of experts that are pediatrics and that work in the field of healthcare for children and adolescents. A goal that I'm going to focus on mostly is goal 17, to involve children and adolescents in the organization of care. So here we've, this stems from, unrelated from the strategy, this stems from a study that we've conducted from 2019 and 2021, which was based on a questionnaire with 133 children's wards in hospitals that have filled out the questionnaires and also qualitative interviews with parents. Published in German, but I'll give you some insights into what we worked on. So we've focused on the need for participation and information, which are children's rights, also or especially in the hospital settings. We worked based on the EACH Charter, which includes 10 points to set out the rights of sick children and their families before, during, and after hospitalization. So this includes some very general things like hospital admittance only if necessary, the right to have parents present, but very importantly also Article 7, children should have full opportunity for play, recreation, and education suited to their age and condition and shall be in an environment designed, furnished, staffed, and equipped to meet their needs. So in our study, we saw that the main challenges for this type of participation of children and adolescents in hospitals are the lack of time, language barriers, the developmental status of children, and the involvement of parents. So sometimes parents are too involved, sometimes they are not involved enough to support their children to participate. And concerning the facilities and architecture are often not suitable to fully implement all of the points for the EACH Charter. There's often too little space, and most of all, hospital settings are just not patient-centered enough. So to conclude the strategy, going back to the child and adolescent health strategy, The last thematic area concerns healthcare for children and adolescents with specific illnesses. So this builds on the sixth thematic area, but goes a bit further, going into integrated care, which continues to be a challenge in Austria. It also applies to the area of child and adolescent psychiatric illnesses and for children and adolescents in need of therapeutic interventions. I'm not going to go through all of the individual goals. As I said, you can always look at the presentation if you want more details. So just summarizing up and going back to today's focus of the webinar, children's rights to play and participate in artistic activities in healthcare settings. Children and adolescents need spaces where they can be themselves, so they can learn about their strengths and abilities, so they can learn about limits and how to deal with dangers, so they can acquire the skills to deal with the realities of everyday life and social life. Healthcare settings are especially important in this aspect because during a difficult time, play and creativity is even more important than in everyday life. A positive experience within the hospital setting is important for children, and play and creativity can support the communication as well as the healing. The Austrian strategy for children and adolescent health that I've presented to you is trying to support actors in various fields, but I can conclude that there still needs to be a lot more in terms of children's rights. So thank you very much for your attention, and of course, I'm happy to answer any questions.
Thank you, Lisa. Great presentation. Thank you very much. You're doing a stellar job. I just want to read the document as it is very interesting for, I think, all the participants to understand how strategies can be implemented, not only planned, but implemented. You mentioned two very interesting points, which is creating child-friendly or child-respectful settings. This goes back to projecting spaces, and this links back also to all the work that Helke is doing in the HPH network. So it's very consistent with what we are going to see later on, and the EACH Charter, which is a pivotal reference for children's participation in hospitals and healthcare settings. So I think that together with convincing medical doctors and professionals on how important it is to find a place for children to play and perform arts, because it has a direct and evidence-based impact on their health, positive one. It is very important also to convince architects, people who give another kind of point of view to planning spaces, how it is important to find criteria that respect children's needs, not adults' needs, especially in pediatric departments or hospitals. I don't know if you have questions for Lisa, please write in the chat. I'm seeing one chatting. There is one question. How far do you think that access to arts is already being considered as a social determinant of health? What is the experience in Austria?
Is this in general, or is this for the hospital setting, this question?
I believe it's in general. It's not reference
it sounds
to,
in general. Yeah. I would say that there is a small awareness that arts does play a role, but it could be stronger. So I think, especially focusing on children and adolescents, I think the whole area of having settings where they can play is a lot stronger. So there's more awareness of playing and just moving and acting and being themselves as a determinant. Art is, I would say, still a rather small awareness.
I don't see any other questions for the moment. There is now a short break, but I would like to say to the speakers that we have people from all over the world. So this is very, very nice, from Greece, from Prague, from Australia, Sweden, Netherlands, Germany, Austria, of course, Qatar, Rome, Bambino Gesù, Scotland. So thank you very much for your participation. And we also had a message that was very interesting from a Swedish colleague on a practice they carry out in the region Östergötland, where they have this intervention culture for well-being, where patients can get cultural activities as a complement to treatment. This happens in cooperation with cultural actors. This is very interesting. If you have other practices, please, Ireland, please feel free to share in the chat section. Okay, this is an amazing audience. So I give you, as you are amazing, 5 minutes, and 10:31, let's be here and continue with other very high profile speakers. Okay, thank you. See you soon. Welcome back. Welcome back. Let's continue with this great audience, great speakers. And the next one, I'm sure I'm not mispronouncing her name this time, is Silvia De Faveri, who is head of the research and learning department of Red Noses International. She has worked with several international and non-governmental organizations on projects related to children's protection and well-being. Her current focus is exploring the impact of healthcare clowning on the mental health and well-being of different groups of people. And thank you very much, Silvia, also for taking care of whole the organization with Carmen, and you really put a great effort into this moment. So thank you very much for being here, and the floor is yours.
Thank you so much, Ilaria. I also want to take the opportunity to thank you and the HPH network. It's been great working together and a lot of fun. So great experience. Thank you. And it's not over yet. So hello, everyone. My name is Silvia and I work with Red Noses International, and I'm very happy to bring into the webinar the perspective of a healthcare clowning organization. And I would like to start by sharing with you a very short video about our work. So bear with me 1 second. While I Okay, now you should be able to see this. And here we're back. This was a very short introduction about our work. And now I would like to continue with our presentation. And I hope you can all see this. Otherwise, please, Ilaria, let me know. We are Red Noses International, and we are an artistic organization that brings humor and laughter to people in need of joy. This is our mission. It's really to bring a smile and positive emotions to people who need it in the time when they need it the most, in challenging times or hardship. How we do it, we have a whole series of artistic formats and intervention that we use to engage with different groups of people in different settings and contexts. So, for example, we do clowning with children in hospital, and this is what we will talk about today, but we also do clowning for the elderly in elderly homes, and with forced migrants and aid workers in humanitarian settings. And we also work with children with disabilities. So it's really, we try to cover different groups of people, and to do so, we use different artistic activities. But let's go a little bit, let's talk a little bit about us again. And our Red Noses network comprises 11 countries. So we have 11 countries offices across Europe and the Middle East. And here is a very brief overview. So far we have, well, these are 2022 data. And by then we had 476 professionally trained clowns. And I really want to strengthen and put a focus on this. We put a lot of focus into the education and professionalism of our clowns. And we have a very thorough education program, and we provide our artists with a whole series of workshops, trainings, and also lectures by experts in different fields, which can be, of course, psychology, child psychology, sociology, but we also work a lot with the psychosomatic experts, trauma experts, and of course, we engage constantly with the healthcare staff, including doctors and nurses and health and care practitioners. So we really try to give a very strong and solid background for the artists on which they can perform their beautiful art. And of course, we work also with a lot of experts from different performative arts. We have done in 2022 more than 19,000 clown visits all across our organizations. And now today we're going to talk about hospital clowning in hospital. And so I would like to focus and start focusing more on clowning for children. And we have different types of formats and interventions, as I said before. Here we can see a bedside visit, which is when usually a clown duo, in our case, a clown duo, go and interact with the children who are staying in hospital. And they really offer the child individual attention, and they are really able to create meaningful and human connection with the children, even if it's in a very limited amount of time. And this is really important for the children to really feel that they're heard. This time is only for them. It's only to make them laugh. It's only also to give them, to make them feel that they are in a safe space in which they can really share all the range of emotions that they feel. We also have, we also perform clowning during or before medical procedures, and this is what we call intensive smile. And I think what is interesting about this image also is that it shows really well the sort of connection and collaboration that we have also with the healthcare staff in these specific interventions, because we really share information with the healthcare staff before the procedures, before we start before our artists start clowning, so that we know exactly what is the procedure about, what the healthcare staff needs from us, and at the same time, how we can also think, the artists can think, how can they provide a very tailored, artistic interventions for children, making sure that they feel safe and comfortable during this procedure. And we also do clowning with children with disabilities. And recently we have finished a project in which we developed some specific clowning skills for interacting with the children with the autism spectrum disorder, for example. Last but not least, we also have humor in healthcare workshops for healthcare staff and students. And these are workshops that are led by some of our expert clown artists. And in these workshops, the artists really give an introduction, they really guide the healthcare staff and student into the world of clowning and what it means to work with humor, and not only humor per se, but also how can we create a more empathic connection with our patients? How can we really make sure that they feel heard, that they feel, that also their emotional needs are taken into consideration during everyday practice at hospital. So this is also another moment in which we really create strong bonds and collaboration, with the healthcare staff in institutions. I would like to point out that, yes, our work is evidence-based. We take clowning very seriously. We have put together a research database that gather all, or let's say it's growing, it's a work in progress because the literature keeps growing. We're trying to put together the literature that talk about the impact of healthcare clowning on the mental health and well-being of different groups of people. It's about not only children, but also the elderly, forced migrants, healthcare staff, the children's relatives, the children's parents, etc. So I invite you to go and check out the research database. There's a lot of articles in there, and most of them are academic journal articles. Let's go a little bit more in depth into that. We know, and it's proved that we have an impact on children, for example, and multiple research studies have shown that the presence of clowns can decrease the children's anxiety, distress, perceived pain, and also the time that they spend crying. At the same time, we not only decrease, but we also increase the children's morale, and we also stimulate their imagination. And here I just put as a reference 2 articles, but there are so many more. So please feel free to go and explore our database for this as well. We not only have impact on children, but we also have impact, of course, on their parents in an indirect and direct way, because the parents, on the one hand, they are very happy and relieved to see their children having fun. And on the other hand, they also have fun themselves with the clown's activities. So healthcare clowning can improve really the parents' mood, decrease their anxiety and stress before and after their children's medical procedure. And this is another reference of how this has been proved by peer-reviewed studies. And also we have impact on healthcare staff. So when we work in a hospital, in a ward, this really improves the atmosphere and the communication within the healthcare unit, as well as enhance collaboration with the patients and the relatives. So some medical staff have mentioned that they found it easier to communicate with their patients. And I think that this is also a very great impact and effect that clowning has. Also, some studies have reported that the staff members have lower levels of stress when the clowns are around. And also they can work more efficiently because the children are often distracted and engaged in the clown's artistic activities, and the healthcare staff can carry their medical procedure undisturbed, let's say. Again, another reference, academic reference. In our organization, we're really focused on learning, as I think you have understood by now. So we carry out regular evaluation to see how we can even improve even more our impact and the impact that we have on children in hospital in this case. And we also publish some research publications that put together the main findings on the impact of healthcare clowning. In this case, I put here our research nugget on clowning in hospital and a short one-pager, research at a glance, that talk again about our impact with children in hospital. And I invite you also to go and check out our website, where you can find more publications and more evidence on our work. We also have some research projects that involve directly our Red Noses artists. And here I'm very proud to present you with two research projects. One, it's already finished in Motol University Hospital in Prague, in Czech Republic, and another one is ongoing with the University of Vienna. So how we do it is that, yes, of course, we our clowns are performing, but we always collaborate with academic institutions to collect rigorous data and, to prove objectively whether healthcare clowning has an impact or not. By now, I think it's a little bit more evident why we need artistic humorous activities for children in hospital. We do have an impact on many people. We have an impact on the children, on their parents, on the healthcare staff. And this also is very much in line with the WHO definition of health that I put here. So health is a state of complete physical, mental, and social well-being. So, healthcare clowning can really help taking care of the mental and emotional aspect of health, as is defined by the WHO. And it's important to include also this in the healthcare system. And at the same time, of course, this is the beautiful report that Niels Fietje spoke about in his presentation. And also the UN Convention on the Rights of the Child mentions that children should have the right to leisure and play. And also all the state parties, everybody should promote the right of the child to participate fully in cultural and artistic life, and also provide appropriate and equal opportunities for cultural, artistical, recreational, and leisure activity. So our match is very much in line with also the international policy on healthcare and rights of the child. And I would like to conclude my presentation with a beautiful quote from a nurse that works with the children with autism from Finland, which is together with another partner clowning organizations. We carried out this project that I mentioned before that that worked with the children with autism. And the nurse mentioned, in the hospital, the situation is created for us, medical staff, and it is stressful for the children. We assess, evaluate, push them to their limits, and get information out of them. Interacting with the clowns is the one thing they can genuinely enjoy during their stay here. Without the clowns, it will be too clinical, and the child will only be an object of our observation. Of course, this is her perspective and point of view, and we absolutely acknowledge and highly value the work of the medical staff with the children in their everyday work. And we know how much the healthcare staff is subjected to time pressure, and there's a lot of patients to take care of. And here is where the clowns can really come in to provide singular individual attention to each child, and to make sure that we give children the best and the more comprehensive healthcare that they can get and that they deserve. So thank you very much for your attention, and I invite you to go and visit our website once again. If you have any questions, I'm also happy to answer. Thank you.
Thank you, Silvia. Great presentation. Thank you very much. It is impressive, the volume of activities you are managing and starting. And when I said before in my presentation that children's rights are not just principles, but standards, you are proving that, luckily I'm right, because you are carrying out these actions in partnership with health staff, which is the key factor for a winning strategy. I see some questions in the chat. Two questions. I can read them for you if you want. Since Red Noses is only currently operating in 11 countries, as indicated in the presentation, I'm curious to know how expansion to other countries occurs. This is the first question. In other words, do hospitals in countries where Red Noses is not implemented have to request for you to establish their countries, or how does it work? This is the first question.
Fantastic. Thank you, Ilaria. Thanks for the question. Yes, it's great. I think it's, Red Noses is only one healthcare clowning organization, or let's say one group of healthcare clowning organizations. But I think it's really important to stress that in Europe, and not only, also worldwide, there are several professional healthcare clowning organizations that do artistic activities with different people. So, and Red Noses, together with many other organizations in Europe, we are part of EFCO, which is the European Federation of Healthcare Clowning Organizations. And there are, I think, more than 40 or many more than 40 healthcare clowning organizations in the group and also outside the group. There are really plenty. And I think that this is really great because there doesn't need to be specifically a Red Noses clowning organization in each country, but it's great that, if any country, that all countries can really get in touch with these healthcare clowning organizations and trying to establish a contact. And so this is really just an example, but the scene is much bigger out there.
Okay, so the second question is, does Red Noses have children or adolescents who are trained in clowning to act as peers for hospitalized children or children in other settings where clowning is needed? Is there peer-to-peer kind of activity?
So children and adolescents who are trained in clowning to act as peers for hospitalized children, not yet. Not really. We don't work with children and adolescents. Right now we have only adults clowns, but this is definitely an interesting perspective that we'll be happy to think about, or how we can, include children in our artistic practices. The way that we do right now is that sometimes we also have activities in which children really connect with each other. So we have, for example, something called the Circus Smile, which is activities in which the clowns teach to a group of children some skills from the circus art. So it's about juggling, magic tricks, etc. And through these activities, children can really interact with each other. And it's about, forming a group, feeling that they are part of a group, interacting with each other, exchanging, giving strength to each other in difficult situations. So it's really about creating bonds. So this is already a way in which, we try to have children connect with children.
That's great. So Silvia, please check the chat. Could be there are other questions for Jorn and Carmen.
Mm-hmm.
In the meantime, I will present the next speaker, who is Dr. Elke Miedema. Please, Elke, forgive my pronunciation of your name. Is a researcher teacher, which is a job that focuses on strengthening the relation between education and applied research. At the Innoland University of Applied Sciences, she's part of a multidisciplinary research focused on resilient and livable cities, with her expertise on the design of health and care buildings and design of health promoting living environments. She is also the leader of the International Task Force on the Health Promoting Built Environment. Please, Elke, the floor is yours. Thank you for being here.
Thank you so much for having me, and Peyton, actually. So this presentation is pre-recorded because Peyton Ford, who helped me set up this presentation, is in the US, so not able to join for today. So I have a pre-recorded 8 minutes slide set, and then afterwards there's of course time for questions, and that's why I'm also here. So I'm gonna turn it on. We have tested it, but please interrupt me if the sound is not working. Hello everyone, my name is Elke Miedema.
And I'm Peyton Ford.
And we will discuss the role of the built environment for healthcare organizations, and particularly for pediatric healthcare and child-friendly design. So to start with, health promotion building design is the design of healthcare facilities that encourages vulnerable individuals to take control over factors that positively impact their health. In this case, of course, vulnerable individuals, children, their relatives, as well as also the staff working in that area. The design of healthcare buildings can influence health of different users, the patient, staff, relatives, but also the local community and the health of the planet. And this is already confirmed in quite some different guidelines, such as the WELL certification that relates to, for instance, the 10 concepts that you see in the middle. You also have active design guidelines, and there's a whole journal, academic journal, focused on health environments research and design, where you can find more information if you're interested. There's a growing body of studies that indicate a relation between design, healthcare settings, different healthcare outcomes, and populations. And the majority of that research used to focus on patients, but thankfully there's more and more attention to personnel and visitors as well, which is particularly important also in pediatric healthcare.
Speaking of the research and especially important features for pediatric care, through studies we've identified that it's essential for pediatric care environments to incorporate home-like features, personalization, and natural connections to the outside world. And increasingly, we're working to bridge the divide between this research and actual embodiments in physical design by developing more specific design strategies across core spaces of care environments to actually implement these features in practice. So for instance, next slide, please.
Oh, right.
We know that approach and entry, unit layouts, waiting and reception, and corridors are 4 essential areas of pediatric care design. And within these areas, we have a few examples listed of design strategies that can help to integrate feelings of hominess and comfort. So for instance, in the approach and entry, it's essential to include colorful facade features to invite children to the space and make them feel more comfortable in the environments. In waiting and reception, it can be beneficial to incorporate interactive media and wall displays as elements of positive distraction to minimize fear and concerns for upcoming procedures. In terms of unit layouts, it's been found that it's important to create a centralized layout that brings together areas of both public and private space to encourage social interaction as well as time for respite. And finally, within corridors, it's important to continue to minimize anxiety by integrating sensory pathways to guide both patients and families through the space, as well as child-friendly signage to make the environments accommodating to the young people that they're caring for. In terms of a few of the key spaces, we also think about how to integrate child-friendly design within patient rooms and bathrooms through both semi-private and private spaces that accommodate the preferences of more social children or those that would prefer private areas of respite. In family and visitor spaces, it's essential to integrate home-like features that will help to ease the experience and transition from more normal life, even within the hospital environment. In terms of aesthetics, this is a core key area where we can actually integrate elements of biophilia and improve the seamless connection between nature and the indoor environment to help to continue to promote that sense of peace for both patients and their families. And finally, more specifically within sensory-friendly environments, we can integrate things like aromatherapy and soothing sounds to activate the 5 senses and bring peace for pediatric patients.
Yeah, and I think we go through a couple of examples of what that can look like, but please take the time also to look for examples, and we share with you the names and some inspiration, but yeah, we have limited time today, unfortunately. So one of the examples is the Alder Hey Hospital in the UK. Here you see a very green environment, park-like environment in the middle of the city that. So I see that the recording is not correct, so I'm going to quickly switch to the PowerPoint. Because you actually, as an architect, of course, we want to share images, which if you have the images of the wrong presentation, that's not really working. I will stop share very shortly, but then I get back to resharing. 19 Teams. Or not in Teams. Oh, I do hate this, especially as we practiced, and then it still can go wrong. Share. These we have hands. And then, yeah, so this is the Alder Hey that I was talking about. This is the Alder Hey Hospital in the UK. And it's like it's in a city and it has its fingers out to the park that is around, which basically means that there's a lot of green surrounding it. So all of the rooms have view on nature, but it's also that, as you can see on the balconies, that even for people who are not able to go outside as easily if they're in bed or etc., that they're still able to go outside and have the view on nature. So they try to incorporate it as much as possible. And you can also see, for instance, that on the walls they have used sensory, artistic, playful, signage, or it's not just a simple wall, but it actually brings more than that. And I think that aligns also with what has been said today as well, to the role of art, the role of playfulness and joy in such important environments. And here, still the same hospital, they have like one enormous public lobby, you could say, or a waiting area. So instead of having waiting areas near to the doctor's office, they decided to give everyone sort of a code or a name as soon as you register and you come into the building. And kind of similar to an airport, you will be notified 10 minutes before your meeting. So you're not endlessly waiting in this very boring waiting room, but you can just play and be the library or go and eat something and discover the playgrounds. And when it's your turn, you can be called, like Cinderella's meeting is up in 5 minutes, go to the department. And this creates much more rest, and the quality of the spaces where they can wait is much higher because it's in one place instead of divided throughout the hospital. Here you see a room in the same hospital that's very, it's colorful, but also try to reduce as much as possible the electronic devices, of course, views to the outside. And in this case, they chose to have kids in the same room because sometimes it can also help with loneliness. It depends a bit on how it's seen. In some hospitals, you want to have them alone, and because it's safer in terms of bacteria spread, etc. But often there are some changes around. Another great example is by White Architects, Queen Sylvia Children's Hospital, also surrounded by green, very colorful, and art around the facade. And here you see a patient room for the very young kids, but the bed can be exchanged. And you can see a door going directly outside, which is, there's no bump, so you could drive the bed outside as well. And you can see that the bench, for instance, turns into a bed so that parents are always having the possibility to stay. And there's even a small working space. So if the parents may be working or need to do some administration, they can stay there as well. An ergonomic chair. And here you see some more of the more public spaces, very diverse type of spaces. So people can choose what they prefer, round shapes, but also these artworks up there and a lot of natural materials and green inside the building as well. And a little library that is available for the kids to use as well. And that should be familiar, and they can pull back and move out of the wards. To get away from the normal sickness ideas. We talked a lot, or you already talked a lot about art, and this is an example where the kids also made or contributed to the art in the hospital. So creating ownership, but also recognizability, like, oh, it's not only art by artists, but we, like other kids, have contributed to this. And especially this like nature-inspired art can be really good because it doesn't get as old, like it doesn't, if it's very cartoonish and it's maybe for a specific age group, whereas nature-inspired art can, it grows with the audience a bit better. Another example actually introduced to me by Laura, who's also in the audience today as well, Pediatric Cancer Center, very colorful. And here you see examples of art that comes off the wall, etc., and helps with wayfinding as well, to get around a building, knowing where to go, or interactive play activities, also to promote children. So I think I would like to end there. I mean, there's much more that we can tell, but I hope that this gives you some inspiration to the role of the built environment. I will have some references on the next slide. You can always find us out on our website or on the LinkedIn. I will also put both of them in the chat. And I just want to finalize with this example from Sweden, from Norway, which I think is beautiful. This is a tiny retreat in the forest, in this pocket of forest next to the hospital campus, where children can go to celebrate their birthday, or to have therapy, or all kinds of activities take place, but no treatment as in curative or medication. And it's accessible even by bed for kids to go there. And it's set up to be very playful, so the kids can just take out all of the pillows and build their castles, or build a tower, etc. And for me, this is kind of what we want for all types of healthcare, but especially for children, this way where they can be themselves. And I think the people working at this hospital have really seen that children that have been in a hospital for multiple weeks, for instance, they really become smaller and smaller and more quiet. Whereas if they are here, even though they cannot get out of bed, they light up again, and maybe they are open to therapy or open to difficult conversations. So please come with any questions, and I'll excuse me again for the technological issues. Stop share.
Thank you, Elke. This is an excellent presentation, excellent examples that I hope we can find also published in our network, so people can go back to your presentation, to the recording and everything, because really it's so, there was a comment, how refreshing. It's so nice to see how really, settings can be planned. That's for young people, but for everyone should be like that. As you enter hospitals with already a mindset which is not positive, it's stressful, you have anxiety, you are worried, the least you can do as a healthcare planner or manager should be at least give you good space where you can go through your experiences and be assisted by people can really lower your level of anxiety and preoccupation and so on. So this is an excellent presentation. Thank you very much, Elke. Please refer also to the chat for questions if the audience has any. I see one. Okay, there are many observations, so thank you very much. And now that you have all these ideas in your minds, I'm asking the speakers and the audience, everyone, it is time for a little exercise via Mentimeter, because you have seen many contents so far. And it would be nice if Fatima could assist me with the Mentimeter presentation, or Sylvia, launching the link for understanding from you a little few things. For example, our question for you is children's rights in our webinar. It's what is the lesson learned? So my invitation is to take that QR code, go to the link for the Mentimeter questionnaire, if I am correct, and answer the question that you will find. Please, Fatima, correct me if I'm wrong. You can find in the chat the link. Thank you very much, Sylvia. And you will find a question, which is what key points or concept will you bring from this webinar into your everyday job? What do you think you can implement, use? We are seeing, I have to say, very interesting elements here. Use art and humor as a coping mechanism, which is very, very important observation. More connection with each other to share our knowledge. Done, we are here for that. There is a worldwide interest introducing arts and nature elements into healthcare. Researcher on this topic, yeah, please refer back also to the references that Sylvia gave you on research. It's a very, very useful database. Humor and art support medical treatment. Yes, there is evidence for that as well. We should always find new ways to make professionals understand there is such evidence. Partnerships are important. It is important to look at things in a different way, through a different perspective. Not very easy sometimes. What happens when children are on adult wards? There is no space for them there to play. The clowns must find them, right? Because that goes back to what Elke presented, right? Not every hospital is planned to be child friendly. Many times in many countries, I don't know if in yours is like that, in mine it is. You have old buildings, you have to somehow rethink in a way that somehow can also be child friendly. It's not very easy, and when you try to replan or propose new ideas, the costs is always the main factor that stops change. Which is true, you have to take cost into account, but you also have to renovate things. You have to, you know, if there is evidence that supports the kind of change, you have to do it. Collaboration between artists, kids, and employees, right? Think of young adults too, yeah, and of adults, if I may add. Sharing evidence-based research on playfulness, yes, it is very important. So I really hope that with this webinar, we covered some of your observations and doubts and wishes for further, you know, study on children's rights to play and on research we can carry out to improve knowledge on this particular kind of topic and find new strategies, you know, to involve the professionals, whether they're medical doctors or architects, in planning services and spaces for children and possibly co-designing them with children. So thank you very much. I would save all these inputs because they're very, very important for us. And I would now leave the floor to another speaker. We are going towards the conclusion of this very interesting webinar. I say it myself because I learned a lot today from all the speakers. So please, Veronica Schwald is working at the Red Noses International as Deputy CEO and Head of Organizational Development. In her roles, she's focusing on the intentional strategic development of Red Noses, putting purpose, impact, and people in the center. She has already been working with Red Noses in different positions for over 10 years. So please, Veronica, the floor is yours. Thank you very much for being here today.
Thanks a lot. Thank you, Ilaria. And thanks to all of you for this highly interesting webinar today. I really would like to appreciate the different contributions from the various perspectives today. And thank the high-profile speakers we heard in this webinar who helped us to explore the significant role that arts play in enhancing children's well-being and health journeys in general in hospital settings. It is necessary and highly valuable to create more space and enable more discussions where we can reflect on the benefits of arts and health as well as the essential rights of children to play and their right to access artistic activities within the often challenging hospital environment. Therefore, I would like to thank HPH for the good collaboration for today's webinar, especially you, Ilaria, and also thank you for the wonderful moderation today. A warm thank you also to Ilaria, Silvia, Fatima, and Carmen for the organization of this important webinar. Yeah, today we heard a lot about humor and arts in healthcare settings. And we know they play a particularly important role when it comes to overcoming the rational mind and connecting with emotions. We know that art is a bridge to reconnect to ourselves beyond the current situation or condition. It helps us to process experiences, can help to build resilience, or can provide an important moment of relief in a challenging situation. The power of humor allows us to connect with others, provides moments of lightness and hope, and it allows us to change perspectives, which can be important in challenging environments like hospitals. Hospitals are the places where we, as Red Noses, conduct most of our artistic and humorous activities. In this way, we show every day that art is present in unexpected places, that it makes us human, and connects us beyond survival or medical treatment. Lisa illustrated how much play and participation in artistic activities help children and adolescents to be themselves. This is also an important aspect we not only see in hospitals, but also in the work with children in emergency and crisis settings we do. Although the impact of art often seems beyond rational explanation, behind our work is structured training of artists, evaluation activities, and research, as my colleague Silvia illustrated in her presentation earlier. Our theory of change reflects the importance of becoming an integral part of the broader health and social sector to achieve the shared goals. Still, there is a long way to go until the truly systemic integration of artistic activities in healthcare settings takes place. We're far away from giving every child the opportunity to participate in artistic and humorous activities during their hospital stay. There is also a lack of awareness for the children's right to play and the right to get access to artistic activities in healthcare settings. But we cannot leave access to beneficial artistic and humorous activities to chance for patients in hospitals. There's already too much evidence about the benefits of artistic engagement for better health for everyone. Together, we need to aim for a paradigm shift that acknowledges the fact that supporting children through arts is complementary to the healthcare, that artistic activities are not only a cherry on the top, they are truly enriching the hospital environment, as mentioned by Ilaria. And we also need to fully see the mental health needs of healthcare workers and how crucial their mental well-being is for the quality of healthcare. Let's stay closely together and continue the discussion about the benefits of artistic and humorous activities in healthcare settings. We know from our experience that close cooperation is crucial to achieve the full impact of arts in healthcare settings and to contribute to a change towards a more patient and people-centered environment. Artistic activities are not only a right of every child in every environment, but also have a positive impact on the healthcare journey. Let's strive together for a broad recognition of the mutual benefits of arts in healthcare settings. Let's emphasize together the need to allocate resources for artistic initiatives and establish more cross-sectoral partnerships and collaboration among artists, hospitals, and healthcare workers. Let's aim together for healthcare systems in which artistic and humorous activities are fully and systemically integrated into health strategies and health practices. Let's stay together to put arts and health into real practice. Let's join our forces to use the big momentum for arts and health that Niels pointed out in his presentation today. With this common effort, we can make the integration of artistic activities in healthcare a fully acknowledged right and need, And let's jointly tackle the decision maker recognition and their imperative support. One of the next steps between Red Noses and HPH is to draft a policy brief on children's rights in hospital settings, including the children's right to a complete state of health, their right to play, and their right to have access to artistic activities and participate in cultural life. Thank you, everybody, and let's stay connected.
Thank you. Thank you very much, Veronica. Thank you to Red Noses, to Silvia, to Carmen Valero, to everyone from your organization for putting the attention on the children's rights to play, not only. So thank you very much for being in contact with us. And you're completely right. Our next step is a policy brief, but not only. The research field is vast. We can really plan to work together for a very long time, I hope, on research, on projecting, and everything really that can be useful for improving children's health. So thank you very much. I believe there is one raised hand from Maria Linderstrom, right? So if you want to just say something, please do. Otherwise, write down in a chat if you prefer. Okay, because I saw your raised hand. We can also take some questions if you want. We are in advance, perfectly on time. So if you can't think of any questions right now, just please consider that we are always open. So there is always time for questions to write to us, to the HPH network, to Red Noses. You have seen our addresses, so please always feel free to contact us. As for me, as I don't see any other questions, thank you very much. Thank you to the audience for being here today. I take with me some very, very nice key words, concepts, like the importance of partnerships. We are building here today as well with professionals from, architecture, medical sciences, everyone who is interested in promoting children's rights. Evidence and research, let's keep building evidence and research and disseminate through our networks so that all professionals can be reached and aware of how they can improve children's health. Children's participation, co-designing spaces. This is a very interesting field as well that we should study more and more. How can we involve them more and more in our activities and collect their point of view? And of course, last but not least, let's keep on working for children's rights, from children's health and well-being. I do believe we are a great team, referring to the speakers and to the audience as well. So we are here for that. Thank you very much for being with us today. Thank you to all the speakers for finding the time, and to the audience for finding the time. And I hope to see you soon to continue working with you all. Okay. Thank you very much. Thank you, Fatima, for supporting us and the organization of all the webinar. Fatima is a project coordinator from the HPH network. So thank you very much for being with us from all over the world. Bye Australia, bye Ireland, bye Europe, bye Qatar, bye everyone. See you soon. Thank you. Bye.
Thank you.
Bye.
Thank you, Ilaria, for the wonderful moderation. Thank you.
You're too generous. Thank you. Thank you. Bye.
Have a lovely day, everyone.
You
Bye-bye.
too. Bye.